Good morning, everyone, and thanks for joining us today. And thanks to Dr. Lewis for taking time out of his busy schedule to join us as well. This is likely my last media availability with you as Health Officer of the Snohomish Health District. I want to thank you all for what you've done to help keep our community informed over the last few years. Thank you for continuing to report on COVID-19 and other public health issues. Your work is greatly appreciated by us and the community. We couldn't get our word out without your help. So again, thank you very much for your efforts and support. As I'm in my last full week of on-site work here in the health district before we transition over to Dr. Lewis in August, and I'm just the sentiment that comes to mind is really gratitude for a great long period of time of having worked for the health district, the good fortune of having been given a chance in the first place 28 years ago, and to still be here now is just a privilege to work with all these dedicated public health professionals and the community around us. I do want to thank all the partners who have supported public health efforts, both before, during, and hopefully after the pandemic. That's Snohomish County government, our schools, cities, businesses, fire and EMS services, law enforcement, healthcare providers, volunteer organizations, and so many others who have stepped up to meet the challenges that the community has faced in the last couple of years. I especially want to thank the health district staff, not just for their work during the past couple of years, but really during the whole time that I've been here. Serving as a health officer is really about teamwork, and I've really been fortunate to have great teammates, dedicated public health professionals, as I said, carrying out the work of the district day in and day out, whether that was as part of the COVID response, and the flexibility and endurance that it took so many of our staff to engage in that, as well as the people who stayed with their routine work and keep the wheels of public health rolling independent of the pandemic. So I really am humbled and thankful for all they've done to help me do what I can do to support the health district's work. Going forward, I am very confident that the health district and the people of Snohomish County will be in great hands with Dr. Lewis. James is a well-trained and experienced public health professional. He is trained and board certified in internal medicine, infectious diseases, and preventive medicine, public health. He's had a career working with the North Carolina State Health Department before coming to Washington State, and then more recently has been working with Public Health Seattle and King County, primarily in their COVID response, but also in other respects very relevant to the health officer work that he will be doing here. So I'm just happy for us that we got him to come work with us, and I know he'll take the position and the health district to new heights in the years to come. So again, thanks to all of you for all your work. It's been an honor to serve the people of Snohomish County, and I really think great things are ahead for this community. So with that, again, I'd like to introduce you to Dr. James Lewis, who will be starting as health officer on August 1st.
Well, thanks so much, Chris. I mean, Dr. Spetters is going to certainly be a hard act to follow, big shoes to fill, but from what I hear, Snohomish has got the health district's got a great team, and so I'm really looking forward to working with them. I'd just like to say thanks for, all your help over the past couple of years, Chris. A couple of memories that I would just like to share is all of the projects that we've worked on together around different investigations that have been cross-jurisdictional, development of various guidance together, working particularly around issues in long-term care, and then more recently looking at COVID hospitalizations as well. Certainly your calm, collected, and reassuring presence has been extremely helpful during a really stressful period, maybe the most stressful period of the public health in the United States has experienced. So really appreciate all that. And I was very, just honored and grateful whenever you reached out and let me know that this was a job that was available. And I really look forward to, and I feel just incredibly lucky to have gotten the opportunity to come and take over this role from you. So thanks so much. And just a couple of things I'm looking forward to working here or working at Snohomish is going to be, meeting and working with a new team. I really got to know everyone at Public Health Seattle and King County over the past couple of years, and it's just been an incredible experience. And I'm looking forward to doing that again with the great folks there at Snohomish Health District. And then also I'm really excited about the opportunity to be there for the integration with the county. So the health district merging with the county. I think that's a great opportunity and will be an exciting time to be the health officer there. So I'm really looking forward to that work and working more closely with the county and making that successful.
Dr. Lewis, I'm afraid you froze for a minute. Are you still online with us?
With that experience. And then also getting back into the office. Dr. Spitters is there in the office here at King County. We've been 100% remote for quite a while now, and it gets a little lonely. So I'm really looking forward to getting back in the office. And then also as far as, what I'm excited to work on, I think the COVID pandemic is going to keep us busy for a while yet. And really the transition of the pandemic from kind of an acute, pandemic to endemic disease is going to be an interesting and complicated process, I think. And so we're kind of in the middle of that now, trying to figure out and navigate how that's going to evolve. So certainly that'll be a big focus. And then I'm really looking forward to reviewing the new community health assessment results that is about to begin and being involved with the rollout of that, and really having that drive the priorities of the health district from my perspective, since that will identify the biggest health issues for the population there in Snohomish County, and the goal should be to improve the health of the community members within the county. And so having that assessment will really allow us to set those priorities in a way that'll be most efficient and most beneficial to the community members. So really looking forward to that. And thanks so much for having me today, and I look forward to taking any questions.
Thank you both so much. And we do have a question here in the chat. So Dr. Lewis, what do you think the biggest challenge will be in setting up a new health department under the county? And is there anything Snohomish County could learn from where you're coming from in King County as far as the transition?
Well, that's a great question. I think that, the hardest part is just going to be the transition to a new organizational structure, although that won't really affect the public health team too much, given that, we're going to maintain all the employees and the structure, but then kind of just transitioning the way we make decisions and getting everything set up to go in a pretty short timeline. We're going to be supposed to be officially transitioned January 1 of next year. I think that will, there'll probably be a lot of I's to dot and T's to cross between now and then, and probably a lot that will realize kind of coming up to the wire there. And so I'm sure that'll be challenging. But honestly, after that, I think from what I've heard from Dr. Spitters and the team is that they've worked really closely with the county over the past couple of years during the pandemic already, and a lot of that will be has already been scoped out essentially over that time period. And so I don't anticipate huge challenges there. I do look forward to the opportunities that it brings, as I think there will potentially be opportunities merging with the county to work on expanding some of the public health services in the county. So I'll be looking for any opportunities for that. And as far as what we can learn from, my experience at King County, I think there may be some things that I can bring to the table, given that King County is under, a county system already rather than a separate health district. But what those specific things will be, I think only time will tell, I guess.
Thank you. And a follow-up question. So our county executive has set out a goal of starting new direct services under a new health department. Do you have any ideas of what those could look like? Anything specific you're looking forward to starting up?
Yeah, I think some of that will probably be at least informed by the community health assessment that will get done. But I do think some big things that will be great to reinstitute that I believe my understanding is Snohomish County had in the past is going to be sexual health clinic services as well as immunization services. So those are two big ones that I'm hoping we can reinstitute. But as far as other direct services, we'll have to wait and see what the opportunities are, and probably also what is seen to be priorities based on that community health assessment will probably inform that to a large degree. I don't know if you have anything you would like to add to that, Dr. Spetters.
Oh, I think you really hit the mark with that, James. Historically we did have immunization clinic, sexual health presence, and due to a intersection of budget challenges with the financial crisis in 2008, 2009, and some evolving policy around the health district focusing on epidemiology prevention. It kind of led to a de-emphasis of direct clinical services there for a while. And I too think that deserves reconsideration. I think the pandemic's taught us a little bit about that as well. And so I really look forward to seeing how that process unfolds, and I imagine that the service capacity will be increased in the coming years.
Thank you. And our next question in the chat, Dr. Lewis, with the recent decision on Roe v. Wade, have you thought about the ways that will impact the Snohomish Health Department and ways it will navigate the changing national landscape?
I have thought about it a little bit, mainly with regard to the way it will affect King County in my current position, but starting to think about it in terms of the Snohomish Health District as well. First of all, I'm just extremely disappointed in the outcome, although, given the leak of the draft early on, it was not surprising, unfortunately. But I do think we will certainly need to have a focus on maintaining, women's health and the ability of women to be able to make choices about their own bodies and in a way that is accessible to everyone in the population, including those who may not have access to health insurance and other supports. So certainly that will be a big conversation where we'll have moving forward. I don't know if anything's already been being discussed there at the Snohomish Health District, Chris.
Well, we with the say sort of the downsizing that occurred in the financial crisis a decade ago, and the sunsetting of the sexual health clinics, which were primarily infection oriented, we haven't had much of a presence in the reproductive health world, and have really deferred to the healthcare system and community-based partners around that. But certainly I think a couple things merit saying that at the current moment, there's no change in the legality and the medical practice of termination services in Washington State, and that is the way things are now. And certainly, I think the issue brings up the most positive light is that we need to make sure that all women have access to reproductive health care, and that meets their needs, and it that's something that I think we can all agree on and focus on. And, you know, these larger federal, national, legal and policy issues are complex and a little bit out of my strike zone, but I can tell you that it's a basic tenet of public health and preventive medicine that good sexual health and reproductive health services for women not only benefits their health, but that of their current and future children, as well as the entire community. And so I look forward to seeing where James and the rest of the team are able to take that, working with the community in the months and years ahead.
Thank you both. A couple more questions. So can you explain what your day-to-day looks like at your current position and how that might change at Snohomish County? So I believe this is for Dr. Lewis. Perhaps just because we're a different county with different demographics and cultures here.
Yeah, that's a great question. You know, a big way that it will change for my day-to-day currently is I'll be in the office, most days of the week, whereas now I work from home. So that'll be a big change, and I'm looking forward to that. And currently, you know, my day-to-day is primarily in various meetings around COVID response, also recently, you know, the monkeypox response, and various other issues as needed, and then reviewing, you know, guidance documents or health advisories or writing, you know, those types of documents, and getting them ready to post, and also providing input for our communications colleagues at King County on products that they put up on the website, et cetera, and you know, making decisions about, you know, what types of health advisories or what types of communications do we want to get out to our healthcare provider colleagues in the county. And so I think a lot of that will be similar, but just broader in scope. Obviously, there'll be things that I haven't been working on as much, such as environmental health issues. That will be a lot bigger part of the role as health officer as compared to my current role. As well as being much more involved in all the other reportable diseases that are part of public health, which I do have, you know, some experience in responding to in King County, and then also, you know, much more experience from my time in the North Carolina Department of Public Health, or Division of Public Health, excuse me. So overall, I think it will be somewhat similar, but certainly will have a different lens based on the, you know, the different population demographics, density, and cultures that you referred to.
And follow-up question, Dr. Lewis, what can we expect the county's COVID response to look like under your leadership and under a Transform Health Department starting next year?
I don't, you know, like I mentioned before, the health district and the county have worked pretty closely together, is my understanding, for the past couple of years. So I'm not sure that the COVID response will be transformed significantly as a result of the merger of the district with the county. And as far as, you know, my transitioning under myself versus Dr. Spitters, I don't, you know, we work together a lot, and we, you know, heard each other's thoughts a lot on the COVID response, you know, over the past couple of years. And so I don't think we disagreed on anything heavily. And so I can't imagine there will be a huge difference. And I'll likely try to keep up the good work that Dr. Spitters has already been doing, and also transition with the pandemic as things change, you know, over time, which, you know, we've been seeing, especially over this past calendar year with the Omicron surge at the beginning of the year, end of last year, and now the subvariants of the Omicron variant, and how they're affecting the community in a much different way, it seems, than the previous waves from 2021 and 2020. So I guess what I can say is that I don't think my approach will be much different, but certainly the public health response to COVID-19 will continue to evolve and probably look much different a year from now than it did a year ago, or even right now.
Thank you. And here's a question, well, two questions, one for each of you. So Dr. Spitters, what made Dr. Lewis the ideal candidate for this position? And Dr. Lewis, is there anything Dr. Spitters did during his tenure that you hope to emulate?
Well, I'll go first. Well, first of all, James has all the appropriate training and experience. I think he's really well lined up for this work in terms of his history, and so that's a fantastic baseline, and I think he'll take this position to heights far beyond where I've been able to. But more importantly, I think that on top of that foundation, I've just always appreciated not only working directly with James, but also just observing his interactions with our healthcare system partners and other local health jurisdiction partners, the state health department. I think his manner and effectiveness in cultivating good relationships and making them work to bring services to the community to help improve health have been proven time and again. And I just like the way he goes about it. And so I just have nothing but confidence and optimism about where this place will go under his leadership.
Well, thank you, Chris. I likewise appreciate your approach, and I've to emulate. I mean, I think you really project a similar aura to what I like to think I project, and so I'm glad to hear that you picked up on that, and I hope to continue that approach of just kind of doing my best to, even when I don't feel it, to project calm, collected demeanor and friendly and approachable, and I think you've done a great job of that. And then also pragmatism, being willing to come to the table and really have discussions and with all of the stakeholders in these public health situations that can be extremely difficult to navigate with quickly evolving guidance, sometimes seemingly contradictory guidance between different, organizations or entities, and really figuring out and just centering the whole, the purpose of all of this, right, is to improve people's safety and health, and really going back to that whenever we're having conversations with all the different partners that we work with, and realizing that we all want the same thing, and sometimes we just take a little bit different roads to get there, but ultimately that's the goal. So yeah, I think just continuing to try and maintain the things that you have found admirable in me, which I have likewise found admirable in you, in a new and higher level of responsibility position. So I'm looking forward to that.
And I'll add, if I may, that it's fitting and very symmetric in that we're handing, or I'm handing you the baton, so to speak, when I was coming into the health officer position and COVID was starting. I heard about this Dr. Lewis in King County, who had been working on the long-term care facility situation, and you quickly became our go-to guy for technical assistance early in the pandemic. So I'm really grateful for that help, and I think that was now it's fitting that at the other end of that timeline, you're up to bat. So thank you for taking it.
No, thank you for giving me the opportunity.
Well, it looks like that's all the questions we have in the chat box. Thank you both so much for your time today, and thank you to everyone who tuned in and brought their questions. We appreciate that. Please do stay tuned, and we will provide advisories for any future media availabilities.